One of the villages in Rwanda sector, health counselors are visiting a COVID-19 patient who is being treated at home to see how they are doing. When they are not visiting COVID-19 patients, these health counselors are moving from home to home evaluating residents to see if they have symptoms of COVID-19. These health counselors point out that they face a challenge of inadequate protective gear and thermometers to take people's temperature, with 10 health counselors sharing one thermometer. We don't have enough protective gear. There are sometimes the patient is critical and they need support from you, which becomes a challenge. So we would be glad if they could give us more protective gear that even covers up everywhere. When I'm testing 2 families, for instance, it's possible that another health counselor from another cell will come and ask for the thermometer to work on her families as well. So that time they spend coming to get it, all these are challenges. Among the other challenges they face is the lack of airtime to call and coordinate and follow up on the patients. And as a result, when these counselors go to visit the patients at home, they find some patients are out of quarantine, largely due to a lack of sustainability. There are those we follow up on and they tell us they are home, but when we go to visit them, we don't find them at home, especially those at the border. There are those who are supposed to follow up, but they have no capacity to take care of themselves. They are not capable of getting food for the 7 or 14 days they are required to stay in quarantine. And we have no social welfare to take care of such people in the cell. Gisenyi Hospital Director Dr. Tuganeyezu Orest points out that in the absence of adequate equipment, health counselors monitor patients in a trained manner. The equipment might be less, but as you know, the pandemic keeps changing, and the number of health counselors is also increasing in the country. So we give out the equipment based on how the pandemic keeps evolving. Where there are high numbers of infections is why we supply more equipment. More than 100 COVID-19 patients are currently being treated in their homes in Rubavu district, while 5 critically ill people are being treated at Gisenyi Hospital. It's while the Rwanda Health Center that used to treat COVID-19 patients no longer receives patients.